So Olivia, we've had some heavy lifting over these last number of months since the pandemic. And it's been a stressful time in our organization. It's been stressful for our residents, of course, their families, it's been stressful for our staff. As we're heading into now a season where influenza is the season, coupled with the unknown of COVID, what do you expect and want of our staff? What do we hope for?
I think our response right now, as we're heading into an influenza and gastrointestinal outbreak season and schools reopening, COVID activity increasing in Calgary, we collectively, so residents and staff, and also our external partners, we need to tap into those safety protocols that really took us through the beginning of COVID pandemic. We have some protocols that we know worked and worked very well. Right now, as our society is opening up, of course our risks are increasing. The staff and our residents need to be more vigilant with 6 feet distancing, wearing your masks, especially for residents to wear masks when they're being visited by healthcare providers and external providers such as podiatrists. Washing hands, monitoring your symptoms, staying home or in your room if you're not feeling well, and more importantly, evaluating your risks of exposure. That's not just for our staff, thinking, how will that outing, with family or out of the city, what kind of impact is that going to have on me and maybe my work environment? But residents are faced with the same thing. They also need to pay attention to what they're being exposed. Now is the time to work as a team, follow those protocols together. We have great commitment from our health partners in doing the same, and being good citizens and neighbors. The actions of one person can impact the entire community, and we've seen the evidence of this in the last several months.